This video is about the postural syndrome clinical characteristics classification from the postural syndrome. This is one of the other big three for the McKenzie protocol, mechanical diagnosis and therapy. So mechanical diagnosis and therapy is what the MDT stands for. People say MDT, they also just think McKenzie. So they're interchangeable. This is one of the big three. The other two being derangement and dysfunction. Posture is one that you're not going to see a ton. If they put it on the examination for the McKenzie certification, probably a slam dunk. So pain from the postural, again, reading straight out of the McKenzie Part A lumbar spine handbook for Part A, right? Again, from January 2017. Pain from the postural syndrome is caused by mechanical deformation of soft tissue. What does that sound like? That sounds like dysfunction. Mechanical deformation of soft tissue or vascular insufficiency arising from prolonged positional or postural stresses affecting the articular structures or the contractile muscles, their tendons, or the periosteal insertions. When I go through and learn, and when I started learning about these and I heard about the postural syndrome, I just go, oh, so everything that doesn't fit inside of derangement and dysfunction? Yes and no. But with the postural syndrome, we're listening closely and we're paying attention to one thing: posture. So there are no pathological changes that occur in the syndrome. Versus dysfunction, typically there's a history of trauma, history of a derangement. It's been present for 8 to 12 weeks, something like that. We're looking at postural syndrome. Nothing happened; it just started hurting. No pathological changes. Patients with postural syndrome rarely present for treatment in the clinic, but the prevalence is high in certain population groups. They put students right after this. So thinking students, also kind of young adult category. Not to generalize, but poor posture is becoming a little bit more prevalent these days in the younger generations. So pattern in the history alone, usually they're younger. Usually they're sedentary. Usually it happens after a long period of time. Oh man, I just started feeling it more and more and more. What they say is time is essential causative factor. Symptoms are always local. It hurts in this one spot, and they always come and go. Never constant. Yeah, this hurts. Well, what happens when you move? Kind of feels better. Or goes away. Not feels better, but goes away. So they might have a simultaneous cervical, thoracic, and lumbar pain, right? So if we're thinking dysfunction, we're thinking hyperkyphosis of the thoracic spine as this example that I would use. Hyperkyphosis, thoracic spine. They might have associated neck and lower back pain from poor posture. This only happens by prolonged static loading of the normal tissue. We have to do due diligence, rule out the bad things first. I don't know what's causing it. Start thinking this. There is no pain with movement or activity. What happens when you move? It doesn't hurt. What happens when you stretch? It doesn't really do anything. What happens when it doesn't really do anything? The most common provocative posture is a slumped sitting posture. Okay, you walk out in your waiting room, you see people sitting like this. We can all think of one or two people that comes to mind probably right off the top of our head. So pattern on the examination, this one should scream at you, I think. Poor posture, forward head, thoracic kyphosis, reduced lumbar lordosis, everything to bring that spine into a flex position. Posture correction. This is one of the tests that I was not familiar with until I started going through the McKenzie protocol. The slouch overcorrect test It abolishes the pain. Pain's gone. Overcorrect. There's no loss of movement. Touch toes, lean back, side to side. It's fine. Repeated movements, no effect, nil. And pain produce / abolish on static tests. So that last little bit's a little, I don't know, kind of, when they put that in there, it kind of it makes me go as well. When you're at that point, if you are checking all these other boxes and you get to the end and you go, well, they have to have pain on static test, or it has to be worse, or it has to be better with a static test. Realistically, what does that look like? So, again, postural syndrome, one of the big three for the mechanical diagnosis and therapy McKenzie classifications.